coronavirus disease has once again put India and by extension the world in a state of high alert. In India alone, around more than 50 cases of Delta Plus variant have been detected in 12 states, including Maharashtra, Kerala, and Madhya Pradesh. Good afternoon, everyone. This is Pratyush, Ranjan, Senior Editor, Jagran New Media. I welcome you all in the new episode of Jagran Dialogues today, in which we will talk about the new Delta Plus variant. The COVID-specific Jagran Dialogues is being organized in collaboration with the Ministry of Health and Family Welfare. To understand what is the new variant, how dangerous it is, and about the steps to take to be safe from Delta Plus variant, we have with us an eminent guest, Dr. Saumitra Das. Dr. Saumitra is the Director of National Institute of Biomedical Genomics and Professor at Indian Institute of Science, Bangalore. Dr. Saumitra, welcome to the Jagran Dialogues. Let's start the session with the first question, Dr. Saumitra. First the Alpha, then Beta, then Gamma, then Delta, now Delta Plus COVID-19 variant. Could you please tell us to the viewers that what does it mean? What is the Delta Plus COVID-19 variant? Yes, doctor.
So you know that we have been experiencing this virus for last 1.5 years almost, and it's an RNA virus. तो ये कोई सरप्राइज नहीं है that the virus keep on mutating because इसके जो एंजाइम है वो रेप्लिकेट करते हैं, वो गलतियां कर रहे थे. So because of their mistakes, there are mutations in the virus, and they keep on accumulate mutations which helps the virus for its better infectivity and or transmissibility. But those mutations which does not help the virus, actually they are not selected. Virus उसको carry नहीं करते. तो ऐसे ही चल रहा था. तो पहले हमारा था जो वुहान स्ट्रेन, उसके बाद आया था एक D614G, वो एक म्यूटेशन आ गया था लास्ट ईयर में, and then we just found that it actually covered all the states in India, and later on it outplaced the Wuhan strain, and ये चलते रहते थे. लेकिन अभी वो अराउंड नवंबर दिसंबर एक यूके में स्ट्रेन आ गया था, उसको बोलते हैं अल्फा वेरिएंट अभी बोल रहे हैं. तो वो थोड़ा डिफिकल्ट वायरस था, उसका ट्रांसमिसिबिलिटी ज़्यादा था. So that virus we started probing whether in India which all states are having that particular variant. And then when we were studying that, then there was another variant came from South Africa, and वो जो variant उसको अभी नाम दिया है बीटा variant. So वो जो बीटा variant है उसमें कोई नया mutation घुस गया, and because of that new mutations, now वो जो virus है वो started escaping the human immunity. तो इसीलिए it becomes a variant of concern. Then उसके बाद एक variant आ गया, उसका नाम ब्राज़ील variant. वो ब्राज़ील वेरिएंट को अभी गामा वेरिएंट बोलते हैं. उसके बाद हमारा mutations इधर we found it in Mumbai, in Maharashtra, and then that variant we started calling, initially we were actually calling it as a double mutant. Later on we started saying it as a Delta variant. So this is the Delta variant, which is now outplayed all other strains in the country. It is actually wherever it is going, it is outplacing the other variants. Now, इसीलिए some of these variants, मैं पहले ही बताया है, some of the variants becomes variants of concern. And ऐसे ही अभी nomenclature आ गया, डेल्टा वेरिएंट का जो सब सब lineage होते जाते हैं, उसका अभी हम ध्यान से देखते हैं. And we wanted to check whether it is spreading, whether it is causing more severity or transmissibility. इसीलिए we are actually continuously monitoring ये डेल्टा वेरिएंट. So ऐसी अल्फा, बीटा, गामा और अभी डेल्टा आ गया. अभी डेल्टा का भी एक डेल्टा प्लस आ गया, वो हम बताएंगे.
जी, उसी डेल्टा प्लस के बारे में ही हम बात कर रहे हैं डॉक्टर सौमित्र. उससे पहले एक और सवाल लेते हैं जो कई हमारे पूछा है, क्यूरियोसिटी काफी लोगों में है कि ये वायरस म्यूटेट कैसे करते हैं, क्यों करते हैं, और कोविड-19 वायरस जो है वो म्यूटेट करते करते अब हम डेल्टा प्लस एक नया वेरिएंट देख रहे हैं. जो म्यूटेशन कैसे होता है और क्या सारे वायरस म्यूटेट करते हैं? जी डॉक्टर.
राइट. सो मैं पहले ही बता चुका हूँ, क्योंकि ये जो वायरस का एक एंजाइम है, उसको कहते हैं रेप्लिकेज, वो एंजाइम थोड़ा एरर प्रोन है. तो जब कॉपी करते हैं जीनोमिक आरएनए, उसका गलतियां हो जाती हैं. Because of the mistakes, the mutations घुस जाते हैं, and those mutants which are actually helping the virus वो रह जाते हैं virus के. And because of that mutation, sometimes the virus खतरनाक बन सकते हैं, sometimes the virus become ineffective. So it goes on like this every time the virus mutated. As the virus mutated faster and faster or replicates faster and faster, it actually accumulates these mutations. ये होते रहते हैं.
जी जी. और डॉक्टर सौमित्र, जैसा हमने देखा कि अब डेल्टा प्लस वेरिएंट आ गया है और करीबन 50 से ऊपर केसेस भी अब तक कल की रिपोर्ट तक डिटेक्ट हुए हैं. So how does the government keep an eye on COVID-19 virus mutations? What is the process? ये जो mutations की reports आती हैं, सरकार को या साइंटिस्ट को, रिसर्चर्स को, आप लोगों को ये पता कैसे चलता है कि ये नया म्यूटेशन आ गया? ये डॉक्टर.
तो हम लोग एक कंसोर्शियम बनाया गवर्नमेंट ऑफ इंडिया ने, भारत सरकार ने. तो उसी में बहुत सारे साइंटिस्ट, बहुत सारे एजेंसी शामिल हो चुके हैं. ये एक इंडियन कंसोर्शियम फॉर द जेनोमिक surveillance of the SARS-CoV-2 RNA sequencing. And, we have, at this moment, we have 10 centers. Now we have added another 18 centers. So there will be 28 centers across India, both sare state, so that we can cover all the districts of the country. And we collect samples. उधर से sample लेके हम लोग वो जो RNA है उसको sequence देखते हैं, sequencing करते हैं, and देखते हैं उसमें कुछ mutation आ गया. So 2 things we look at it. One is whether there is some known mutation, something like which we have already seen it in UK or in Brazil or in South Africa. We know that that variant could be a variant of concern, whether we can detect the same mutations in our sequencing or not. और दूसरी ये है कि whether we are seeing some नया mutations आते रहते हैं हमारे में बस, and it crossing the threshold, so that it looks like now it is increasing or accumulating these mutations more and more. So तब हम उसको flag कर देते हैं और we bring it into the notice of the NCDC, वो जो हमारा National Center for Disease Control है, and then NCDC उसको देखते हैं वो clinical relevance है क्या इसके साथ. Do you think that there is a correlations with the severity or correlations with the infectivity? वो जो patient data है उसके साथ इकट्ठा करके वो देखते हैं उसको शायद कोई कोरिलेशन बन जाते हैं, तो वो मिनिस्ट्री ऑफ हेल्थ को इन्फॉर्म कर देते हैं कि एक खतरनाक आ गया म्यूटेशंस, हम लोग शुड जस्ट बी मोर केयरफुल, एंड देन गवर्नमेंट ऑफ इंडिया अकॉर्डिंगली टेक पॉलिसी डिसीजन टू हाउ टू कंटेन दैट म्यूटेशंस एंड रेस्ट्रिक्ट द स्प्रेड ऑफ दैट म्यूटेशंस टू अदर पार्ट्स ऑफ द कंट्री. सो एक रूटीन सर्वेलेंस चल रहा है.
जी डॉक्टर, ये रूटीन सर्वेलेंस जो आपने बताया, बिल्कुल प्रोसेस आपने हमारे दर्शकों से साझा किया. बिल्कुल इसी प्रोसेस को फॉलो करते हुए, जैसे आपने बताया, कंसोर्शियम जो 28 लेबोरेटरीज जीनोम सीक्वेंसिंग की है जो वायरस के लिए कर रही है इस पेंडेमिक के दौरान, मिनिस्ट्री ऑफ हेल्थ ने इसी कंसोर्शियम के थ्रू एक स्टेटमेंट रिलीज किया डेल्टा प्लस वेरिएंट को लेके. इसमें उन्होंने 3 वरीइंग कैरेक्टरिस्टिक्स बताए. पहला इंक्रीज्ड ट्रांसमिसिबिलिटी, दूसरा स्ट्रॉन्गर बाइंडिंग टू रिसेप्टर्स ऑफ लंग सेल, और तीसरा बताया द पोटेंशियल रिडक्शन इन मोनोक्लोनल एंटीबॉडी रिस्पांस. डॉक्टर, हम ये जानना चाहेंगे, ये 3 कैरेक्टरिस्टिक्स बताए हैं मिनिस्ट्री ऑफ हेल्थ ने, इसके एक्चुअली मीनिंग क्या है और हमें किस चीजों का ध्यान रखना चाहिए इन 3 कैरेक्टरिस्टिक्स के सामने को देखते हुए? जी डॉक्टर.
नो, वो जो हमने बताया दैट बिकॉज ऑफ द म्यूटेशन समटाइम्स वो जो वायरस का जो लाइगेंड है स्पाइक प्रोटीन, वो होस्ट सेल के एक प्रोटीन है, बोलते हैं उसको रिसेप्टर, SCE2 प्रोटीन के साथ बाइंडिंग करते हैं. नाउ बिकॉज ऑफ द म्यूटेशन समटाइम्स द बाइंडिंग एफिनिटी ज्यादा हो जाता है, एंड देन वी से दैट द इन्फेक्टिविटी हैज इंक्रीज्ड. एंड एज आई टोल्ड यू दैट इट हैज टू बी कोरिलेटेड विद द क्लिनिकल रेलेवेंसेस, clinical scenario. Now, if we see that because of that mutations, now they are infecting more and more people and transmitting faster, then we try to see that this is more transmissible or more infective. Now, ऐसे थोड़ा predictions है looking at the mutations. ये तो 1-2 mutations नहीं है, there are 7 different mutations which are happening. Now, most of these things has to be experimentally validated in an animal model or some cell culture model. वो experiment actually is going on in different laboratories in India, to strongly establish the correlations that ये mutations के द्वारा, I think it's actually making this more infective, or it is actually somehow escaping the monoclonal antibody. But लेकिन ये ध्यान रखना कि ये जो हमारा spike protein है, इसमें बहुत सारे एपिटोप है, उसके लिए monoclonal antibody बन सकते हैं. Because of mutations, 1 or 2 epitope वो जो है, इसीलिए some of those 1 or 2 monoclonal antibody may not be effective. But it doesn't mean that it is not going to be effective to any monoclonal antibody. So, since there are several epitopes available, several monoclonal antibodies are also available. So, a cocktail of monoclonal antibody, if we use, then that will be effective. तो इसीलिए चिंता का विषय अभी नहीं है, but लेकिन इसके ध्यान रखना है that whether it is going to be more dangerous or not. ये जो दो तीन चीज है. और थर्ड थिंग जो आपने बताया, whether it is showing any unusual trend or not. Whether are you seeing those patients जो जिसमें ये we have detected this particular virus, are they showing more severe characters? Whether for that we need to be little more alert, whether there are अलग से उसको treatment करना पड़ेगा. Those things are very important to monitor. But we are at this moment, we don't have such evidence to say that it has any clinical relevance in terms of the mutation. But इसीलिए हम जानकारी करते रहते हैं, and we are keep on monitoring.
जी डॉक्टर, हम सबको पता है कि दुनिया का सबसे बड़ा वैक्सीनेशन अभियान हिंदुस्तान में चल रहा है. जब भी नए वेरिएंट्स आते हैं तो जो वैक्सीनेशन अवेलेबल है उससे उसकी कंपेरिजन होती है कि इसमें ये कारगर है कि नहीं. हमने देखा डेल्टा में, जब डेल्टा की बात आई थी तो वैक्सीनेशन के बारे में चर्चा हुई है, बताया गया कि ये कारगर उस पर भी है. क्या ये वैक्सीनेशन जो हमारे कंट्री में अवेलेबल है, क्या ये डॉक्टर डेल्टा प्लस वेरिएंट पे भी एप्लीकेबल है? इसकी कोई रिपोर्ट अब तक आई?
नो, सी अगेन मैं वही बताऊंगा, क्योंकि वो जो वैक्सीन जो बनते हैं ना, उसको मल्टीपल एपिटोप होते हैं. अगेन म्यूटेशन के कारण 1 or 2 एपिटोप might be disabled, but it's very unlikely that all the epitopes will be ineffective because of the mutations. So I don't think we should be so worried about 1 or 2 mutations and vaccine escape, right? But we should be careful. We don't have any evidence so far that the Covishield or Covaxin or any other vaccines that are being applied worldwide is completely ineffective to this Delta plus variant. So it is actually, so far, nothing to worry. But it is important to keep on doing experiment and check whether these mutations are effective against the vaccine strain. That is being done.
Doctor, can we say that it's a variant of concern, but not a situation of concern? Because abhi 50 cases across the country detect हुए हैं. So is it okay to say this is not a situation of concern as of now with the number of cases below 100 across the country?
Right. So the situation keeps changing. You know, sometimes it's changing rapidly. So last time also when this पहले हम लोग बताया था महाराष्ट्र में डबल वेरिएंट आया था, and then rapidly it changed its scenario and started spreading to different states. It's very difficult to predict when the virus accumulates one more mutations and then becomes more virulent, right? So it's very difficult to predict, but at this moment you said it correctly that, you know, it is a variant of concern, but the situation needs to be monitored. But हमारे पास इसका एक ही इलाज. If we wear mask, you can protect all the variants. If we avoid crowd, we can avoid all the viruses. So this is यही ध्यान रखना. And if we take vaccine, we can protect ourselves from all the variants. ये तीनों, I think we have to keep it in mind.
जी, डॉक्टर सुमित्रो, there is a fear, अभी सब डर है चारों तरफ कि ये न्यू वेरिएंट जिसकी हम बात कर रहे हैं डेल्टा प्लस, इट मे स्पार्क द थर्ड वेव ऑफ कोविड-19. कई सारे रिपोर्ट सुबह शाम हम पढ़ रहे हैं, चारों तरफ मीडिया में आ रही है कि तीसरी वेव आ सकती है और यहीं से इसकी शुरुआत हो सकती है. सो हाउ डू यू सी दिस एंड व्हाट आर द मेजर स्टेप्स we as a countrymen should take to prevent ourselves, to take as a precautionary measure? You know?
Right. I have already told you, essentially, again, it's difficult to predict that whether this will cause the third variant. But so far, if you really see it in last 2 months, actually since it is being detected and now, it is growing little slow. So, unless it acquires one more mutations and grows faster and infects more people, we can't really say that this particular variant is going to cause the third wave. But we can't rule out that this could be the beginning and it can accumulate more mutation to cause a third wave. That we can't rule out. But what we can actually rule out, what is in our hand, is we check the COVID appropriate precautions, follow COVID appropriate behavior, wear mask, take vaccine, and avoid the crowded place. These 3 things we have to follow. Then we are actually fine.
जी डॉक्टर, आपने भी कोविड एप्रोप्रिएट बिहेवियर की बात की और मिनिस्ट्री ऑफ हेल्थ और कई सारे जो मीडिया हाउसेज हैं, जागरण भी उनमें से एक है जो कोविड एप्रोप्रिएट बिहेवियर की बात करता है और लोगों को बोलता है इसको फॉलो करने के लिए। और डॉक्टर, हमारे जो दर्शक हमारे जो जागरण के साथी जुड़े हैं, उनके लिए डॉक्टर मैं आपसे जानना चाहता हूं कि वो कोविड एप्रोप्रिएट बिहेवियर कौन कौन से हैं और कौन कौन सी वो स्टेप्स हैं जो हमें फॉलो करना चाहिए जिससे हम ये तीसरे वेव और आगे आने वाले वेव से भी हम बचे रह सकें। जी डॉक्टर।
नो, एक तो है मास्क पहनना बहुत जरूरी है, क्योंकि समथिंग यू कैन प्रिवेंट द एंट्री ऑफ द वायरस। सेकेंड थिंग इज यू ट्राई टू अवॉइड people who are infected, people who are actually, sometimes they are not having any symptoms, could be asymptomatic patient. Then in those cases, you won't know whether you are actually interacting with somebody for a little longer and you don't know whether that person was carrying the virus. Isiliye, if both the person is wearing mask, you are safe. Sometimes if you feel that you are in a crowded place, you can't avoid that, you can wear a face shield above the mask or double mask and face shield, wear gloves, sanitize frequently. These are the things in our hand. If we keep on doing it and keeping in mind that you suspect every place, you suspect every person, and you try to protect yourself. ये जब दिमाग में घुस जाए that we are not free of the virus has not gone out of the world, then I think we are alert. And if we are alert, we can actually win over the virus. Most of the time we are relaxed and we are thinking that the virus chala gaya, it's not going to come back, and that's how it's happening. Because it does not have to come from your own country, it can come from other countries. So I think we are actually trying to restrict that when there is a foreign travelers, we need to monitor them strictly and stringently so that we don't get the virus from other countries. Right? Like the other countries are also probing us. When people are moving from India to other countries, people are actually very, very strongly screening them, whether they are carrying the virus or not. We should also continue to do that same screening at the airport so that we don't get the virus. If the virus is seen in a particular state or a district, if we can restrict those people's movement, then we can actually contain that virus in that particular area. And then try to see that those people recover and then they start moving again. So those are all policy decisions. Government is routinely evaluating and appropriately modifying the policy decisions so that it's becoming more effective and we can counter measures for the virus.
जी डॉक्टर सौमित्रो, कई सारे रिपोर्ट पे हमें ऐसे भी सुनने और देखने में आता है कि तीसरा वेव जो है वो बच्चों के लिए खासकर बहुत ज्यादा खतरनाक हो सकता है. So, Doctor, we just wanted to learn and hear from you that is it true बच्चों को ज्यादा खतरा है इस आने वाले थर्ड वेव या डेल्टा प्लस का जो भी हम देख रहे हैं? जी.
No, I think this is an assumption people are making because पहले जो था वो most vulnerable group था above 60, इसलिए हम उसको वैक्सीनेट कर दिया. Then था 45 above, उसको भी हम वैक्सीनेट कर दिया. Then था 18 to 45, उसको भी वैक्सीनेट अभी चल रहा है. So the kids below 18 are not vaccinated. इसीलिए people are thinking that could be the vulnerable because virus will also look for host or human host who are not vaccinated, who are vulnerable, who are prone to infection, virus will target them. So easily people started thinking that if we leave the children out from the vaccination, then they could become a vulnerable population for the future infection. And that by the time the third wave comes, most of this age group above 18 will be vaccinated, hopefully. In that case, only the children will be left behind. That's why people are worrying. But not only our country, other countries are also taking appropriate measures to do that, whether it is safe for the children for taking the vaccine, whether that will save them. So I think we'll take a confirmed decision soon on this.
Right, doctor. So last two questions, doctor. One, for the healthcare and frontline workers, are they prepared for the Delta plus variant wave, the possible wave, or any potential threat of new variants? Because these are the people who actually save other people's life. So how safe they are themselves? Yeah.
Right. I mean, definitely, my own daughter is a doctor, and then she's seeing COVID patient. So this is definitely a concern for the family people who are actually parents of the front workers, or the relatives of the front workers. Our support is always for them because they are saving our life. Yeah. At the same time, we have to make sure that they are not becoming vulnerable. They are already vaccinated, but even they are vaccinated, I think they have to also adhere to COVID appropriate behavior. They can't afford to take out their mask even when they are having their lunch or dinner. I mean, in a population, when you have people around, let's say you have 10 doctors are having dinner together, even then, even they are vaccinated, it's recommended that they maintain safe distance, try to protect themselves from somehow the virus spread from one person to the other person. So I think they have to also keep it in mind that it's very, very important for us to keep them healthy so that they can keep us cured of the disease.
Right, doctor. So message is very clear. Whatever variants are coming, whatever waves are coming, अगर हम कोविड एप्रोप्रिएट बिहेवियर को बिल्कुल स्ट्रिक्टली फॉलो करें तो हम अपने आप को और अपने परिवार को सेफ रख सकते हैं.
Definitely.
डॉक्टर, वन लास्ट क्वेश्चन. कई सारे हम देखते हैं जब से ये कोविड-19 के वायरस पे इंट्री हुई, तब से हमने देखा कि कई सारे फेक न्यूज के अगेंस्ट में इसके रिलेटेड फैलाए जाते हैं, और ऐसा फिर हम अभी डेल्टा प्लस वेरिएंट के संदर्भ में भी देख रहे हैं कि सो मेनी अनवेरिफाइड इंफॉर्मेशन, फेक न्यूज़ are being spread on social media platform. So what's the message from your side for the people who are getting such kind of unverified message? उनको क्या करना चाहिए, डॉक्टर?
This is very difficult to control. I think the media takes the major role. Media should be more careful when they pick up information. They should take information from the authority, not from Aam Janta, because that's how the rumor spreads. So if the media always get the information from the authority and confirmed news and share with the public, that's fine. Number two, panic does not help. So spreading panic, it does not really help the situation to improve. Careful and serious is one thing, but panic is different. I think media should always convey the message that people should be alert, people should be careful, people should be serious about the COVID appropriate behavior. But people should also be also aware of the fact that even if there is a mutation, this is not going to change the treatment regimen at this moment. At this moment, we don't have a different treatment regimen for the variant or a non-variant or a wild type. Different variants, all of them are treated similarly, right? We're just giving symptomatic treatment. So I don't think unnecessarily panicking that whether this person is infected with a variant or a not variant is going to help the, it's more important the patient to use their confidence that they are going to recover and they are going to fight back the virus, they are going to win over the virus. And that helps the immunity to counter. So panic is not going to help either.
जी, समय अभाव के कारण हम इस चर्चा को यहीं रोकते हैं. डॉक्टर सौमित्र दास, आपका बहुत बहुत धन्यवाद. आपने सारे सवालों का बहुत डिटेल्स में जवाब दिए. मैं आशा करता हूं जागरण के दर्शकों को, पाठकों को यह सेशन फायदेमंद लगा होगा. जागरण के फेसबुक पेज और यूट्यूब चैनल पर यह सेशन का वीडियो अवेलेबल रहेगा. इसको आप अपने परिवार में, दोस्तों में, संबंधियों में भेजकर उन तक ये जानकारी जरूर पहुंचाएं कि डेल्टा प्लस वेरिएंट हो या और कोई वेरिएंट हो या और कोई पॉसिबल वेव हो, आप अपने आप को बचा सकते हैं अगर आप कोविड एप्रोप्रिएट बिहेवियर को फॉलो करें, का पालन करें. You can read about this interview on Jagran Hindi and English website as well. Jagran Dialogues aims for health literacy, and we will come to you with a new topic and another guest once again. Till then, do follow all COVID guidelines, get vaccinated on time, stay safe, stay healthy. Thank you, viewers. Thanks to Dr. Saumitra once again. Thank you.
Thank you.